Millions of children under the age of 12 could be eligible for a COVID-19 vaccine in just a matter of weeks. Moderna says a low dosage of its coronavirus vaccine is safe and appears effective in kids aged 6 to 11. Meanwhile, an FDA committee will meet Tuesday to discuss whether to approve Pfizer's vaccine for children. CBS News correspondent Meg Oliver has the latest.
Feels good. Woo!
Tonight, as anticipation builds for younger children to get COVID shots, Moderna says its vaccine is safe and triggers a strong immune response in children ages 6 to 11. Moderna said it used half the adult dose in its trial. Some participants in the Moderna trial reported mild to moderate side effects, but the company did not address the possible rare side effect of myocarditis, an inflammation of the heart muscle found in a small number of teenagers and young men who received the other mRNA vaccine, Pfizer. Fifth grader Jaron Monroe was in the Pfizer clinical trial for 5 to 11-year-olds.
That will make it a lot safer for me to go outside and play all the sports that I play and have fun with my friends and family.
The FDA's advisory committee is scheduled to review the results of that trial tomorrow.
Did you feel like you were taking a risk by having him take part in this trial?
I actually thought it was more of a risk for him not to be able to get vaccinated at the first opportunity that he had.
This comes as the so-called Delta Plus variant begins to spread, accounting for about 6% of all cases in England. It's been detected in 4 U.S. states and the District of Columbia, and the CDC says it's watching it closely.
It has several mutations on the spike protein that we have not yet seen implicated in increased transmissibility or in decreased ability of our vaccines or our therapeutics to work.
If the CDC grants emergency use authorization for Pfizer's vaccine for kids 5 to 11, the earliest some children's hospitals like this one would start administering the 2-dose shot is by the end of next week. Elaine?
Meg Oliver, thank you. For more on this, let's bring in Dr. Shikha Jain. She is an assistant professor of medicine at the University of Illinois, Chicago. Dr. Jain, welcome. So Moderna says it plans to submit its vaccine data on children 6 to 11 soon. According to the American Academy of Pediatrics, more than 6 million children have tested positive for COVID since the start of the pandemic. So how crucial is it that vaccines be properly tested and approved for this age group?
Thanks for having me back, Elaine. I will say it is very, very important that we get our kids vaccinated, especially because we know kids are in school across the country. So we know that COVID can spread through children, and especially if we want to control the spread and we want to prevent new variants from emerging, we need to get our kids vaccinated just like we needed to get our adults vaccinated and continue to need to get our adults and all of our children vaccinated as quickly as we can.
Well, Dr. Anthony Fauci says COVID vaccines for children 5 to 11 could be approved and available by early November, but some parents may be reluctant to vaccinate their kids once the shot is widely available. What's your advice to them?
I can tell all of them, I am a parent. I have children who are 7, 3, and 3. And my daughter got her flu shot 2 weeks ago. And the first thing she said after that was, when can I come back to get my COVID vaccine? The majority of physician parents that I've spoken to are all anxiously awaiting when they can get their kids vaccinated. And we actually did a survey here in Illinois, and almost 92% of the physicians said that they would get their children vaccinated as soon as it was available. I completely understand the concerns that some parents have because the mRNA technology is something we don't see in any of our other vaccines. But I would tell them that the studies that have been done have shown that it is very safe and very effective for our children. And we don't know the long-term effects of getting the virus. So even if your child gets COVID and may not be very ill from it, we don't know what the long-term medical implications are going to be for those children who contract the virus. So I think it's even more important that we get our kids vaccinated as soon as we can.
Well, the FDA is allowing Americans eligible for a booster mix and match their vaccines. The agency says there is no preference when it comes to getting a specific shot. So, doctor, what else should people know if they are getting a booster that is different from their initial doses?
Well, if you're getting a booster, so the first thing to know is if you got the Johnson & Johnson as your first shot, a lot of physicians are actually recommending that you get your second shot as an mRNA vaccine, so either Moderna or Pfizer. And the reason they're recommending that is those vaccines seem to be a little bit more effective than the Johnson & Johnson vaccine. If you've gotten a Moderna or Pfizer vaccine as your first two shots, you can absolutely mix and match, although there doesn't seem to be a huge benefit of mixing and matching in those cases. Some people are suggesting if you had some side effects with the first type of shot that you got, maybe try the other mRNA vaccine as your booster. Right now, the people who are eligible for those boosters are people who are over the age of 65, people who have certain medical conditions that make them immunocompromised or not having as active of an immune system, and people who work in high-risk situations like healthcare workers. However, for Johnson & Johnson, it's looking like anybody who got the Johnson & Johnson vaccine can actually get a booster, and that is because the Johnson & Johnson was a one-shot series and does not seem like it was as effective as the Pfizer and Moderna, which is why all Johnson & Johnson individuals are being recommended to get a second shot.
Well, Doctor, the White House next month will require foreign travelers to the U.S. be fully vaccinated. Now, there will be a few exceptions, including for children and people with certain medical conditions. What's your take on this new policy?
I think it's wonderful that we're getting to a point where we can reopen our travel. And I'm hoping that by creating these guidelines and regulations, we're going to see even more people in our own country get vaccinated when they realize that it will be much easier to travel internationally if you have that vaccine. I also think it's really smart that not only are they requiring vaccinations or a negative test within 1 day of travel if you are unvaccinated, they're also recommending, even for those people who are vaccinated, a negative test. Because again, we know that the vaccines aren't 100% effective, and people with the vaccine can actually contract COVID, although at a much lower rate. So I think it's great that they're utilizing both the testing as well as the vaccine status to help guide the new rules and regulations that are being put in place. And I also love the fact that they're still requiring masks, because as we know, masks and vaccines work together. So it's important, until we get our numbers globally really low and we get this controlled across the world, we need to continue to mask and vaccinate and follow all of the risk mitigation strategies to get this under control and get lives back to normal.
All right, Dr. Shikha Jain. Dr. Jain, thanks very much for sharing your expertise and insight with us.
Thanks for having me.